Hi friends, my name is Annie. I'm one of the licensed technicians here at Moffitt Animal Clinic, and I am here to discuss what to expect your first day coming home from surgery after your pet's TPLO repair. Officially, the easy part is over. Now the hard part begins, the recovery. In order for our surgical procedure to be as successful as possible, following the at-home rehab recommendations is crucial. At home, you should have a crate ready to be able to keep your pet confined, some sort of rear lift support harness, and an ice pack. If you choose to purchase a harness prior to your visit, please fit your pet for the harness, familiarize yourself with how it works, and bring it in with you the day of the surgery to make the discharge process as smooth as possible. If needed, we do carry the harnesses here for purchase that we can fit your pet for the day of surgery and send you home with it. Prior to checking in, if your pet normally gets their anti-inflammatory in the morning, please give it. If it's normally in the evening, make sure to give it the night before. It would also be greatly appreciated by everyone if you take your pet for a walk to urinate and defecate prior to surgery. The reason for this, post-operatively, most patients are usually pretty wobbly, and the medication we give them can cause constipation, so getting out as much as possible before surgery would be ideal. At check-in, we will be confirming the procedure, which leg, and explaining the surgical process. If anti-inflammatories need to be refilled that day, we can do this. Additionally, we will be sending your pet home with antibiotics, additional pain medication, and if needed, a mild sedative to help keep your pet calm during the recovery process for a couple of weeks. If needed, we can refill this as well. After we have confirmed the procedure for the day and signed all of our consent forms, your pet will be admitted for surgery, and the pre-surgical prep process will begin. Your pet's entire leg from below the ankle to the middle of the back will be shaved, and an IV catheter will be placed to allow us to give pain medication, anesthetic, IV fluids, and IV antibiotics during the procedure. When the procedure is over, x-rays will be taken to evaluate plate placement and the new tibial plateau angle. During recovery, you will receive a phone call from us from late morning to early afternoon to let you know how the procedure went, and that discharge will be normally between 4:30 and 5 o'clock. We will be performing ice therapy on your pet in hospital immediately following the procedure, and we recommend you continue ice therapy at home for the next 72 hours, 3 to 4 times a day for 5 to 10 minutes at a time. I really like these ice packs that are moldable. I usually place one on the inside of the knee and one on the outside of the knee. And if you get one like this that has a Velcro sling, it does help apply a little bit of compression to the area and keeps it in its proper location so you don't have to hold it the entire time. There's only a light bandage at the surgical site, so it is very important not to allow this to get wet from the ice. So either using a paper towel or a thin rag between the ice pack and the incision site to keep the area dry will be very important. You may be surprised at how tolerant your pet is for ice therapy, and that is because we inject a local anesthetic to the area that lasts about 3 to 4 days. You will also have written instructions to follow and instructions of when to continue the medication and which ones that evening. When you come to pick up your pet, we will review all the information, and your pet will be walking out of our doors. If you have pre-trained your pet, a ramp in and out of the vehicle is a great option. If not, lifting your pet in and out of the vehicle will be necessary. When you get home, please place your pet in the designated area to continue to rest, and then begin the ice therapy. You can start offering small bites of their evening meal. If they don't want to eat, don't worry too much about it. Just offer again in the morning. Start to familiarize yourself with all the medication and when it's due, and make sure to stay on top of giving it. If you need to pill your pet, please refer to our other videos for tips and tricks on how to do this. Once you've made it through the first day, please review our other videos on how to perform passive range of motion exercises to help ensure the best possible surgical outcome and help give your pet the best quality of life possible. And please, if you have any questions, concerns, anything, please feel free to give us a call anytime. 775-835-8387. Thank you.